Welcome to what we hope will be an ongoing series about all things clinical with Prolink. My name is David Durbin. I'm the Chief Strategy Officer here at Prolink. And with me today is.
Natalie Jones. I'm the Senior Vice President of Clinical Practice and Innovation, a really fancy title for overseeing our clinical organization at Prolink.
So, Natalie and I have been talking a lot as we now work much more closely together through a recent restructure. I'm proud to say that I get to support Natalie and the clinical organization on a day in and day out basis. And some of the things we've been talking about is just how do we drive clinical engagement? How do we help our talent have a better experience, both on site with the clients we support and frankly with us? And Natalie, I know you were just recently in San Diego, I believe, spending a lot of time with some CNOs. And so I can only imagine that this might have been a topic of conversation. What did you all talk about while you were together?
Thank you. We've talked about a lot, and there was a concerted effort in a theme that we heard around experience in the workplace, around retention in the workplace, around professional development, supporting nurse managers differently, and really truly engaging leaders in a much different way. And through that engagement, really was how do we support our talent? How do we support the frontline nurses?
And what folks probably don't know who are not familiar with you, Natalie, or frankly familiar with me, is you joined ProLink a little over a year ago, just before I did, and you came to us from a large health system. I can imagine that was part of the challenge. When you joined us, help folks understand where you joined us from and what your primary charter was as you entered ProLink.
I joined ProLink almost 2 years ago, so January will
See,
be
time
2
goes fast,
years.
doesn't it?
Time moves really fast. I worked for Wellstar Health System, which is a large healthcare system in the state of Georgia, really servicing 1 in 8 Georgians with about almost 8,000 nurses and lots of focus there. I came in as the leader of talent acquisition, but then left as the executive nurse leader for workforce development, and really truly in that role focused on all things workforce, how we could build pipelines, how we could support the communities that we were servicing differently, how do we get ahead in building pipelines and initiatives that would really truly engage clinicians for the long term so that they were long term engaged and committed to nursing or to healthcare overall.
And so, as you and I've talked a lot about being a clinical forward organization and really believing that what will differentiate us, frankly, from a very crowded space is our commitment to our talent. And so, when you joined the organization, you had a very specific charter. Can you help us understand what that charter was and how that's beginning to impact both the talent and clients we serve?
Yes, that charter was to really focus on what we have framed as talent experience. How do we create a landscape, an ecosystem, an organization that is really truly focused on providing a world-class experience for clinicians? And that is really truly in the door from an onboarding perspective through how we partner with the organizations that we work with and creating those programs and addressing the needs that they have.
And so, one of the things that you've talked to all of us about is really the need for clinical development, specifically with our talent. We're hearing a lot of our systems talk about a reinvestment in helping their talent just get better at their practice. Can you talk a little bit about how that's playing out, not only in terms of the talent that we're supporting on a day in and day out basis, but really the role that you're beginning to play with our clients as it relates to developing that leadership component?
Absolutely. Coming in, one of the things that we were hearing from our partners at the healthcare system side was the need to develop not only our team, not only those that we were sending, but also how could we partner to create a leader development program for frontline managers from assistant nurse manager or charge nurse all the way up through the continuum. And we all know on the nursing side, and on the clinical side, that many times those are the programs that are cut first. And so we were able to really come in and partner with a number of health systems who we have close partnerships with to create what they need, starting with a learning needs assessment, and customize it based on what they need into not only a nurse manager program, but preceptor programs and charge nurse programs that would really truly enhance the current workforce that they have.
And without necessarily talking specifically about a client, I know we have a couple of examples, one being out west, and most recently one out east that you and I were together at in New York. What goes into those programs? What are we delivering? How do we deliver it? It's actually a really cool outcome that we've delivered in partnership with some of those clients. So maybe you could give some highlights.
Absolutely. We actually began with that learning needs assessment, which is based on the AONL guidelines. And that partner, that healthcare partner, shared with us the fact that they truly hadn't done a true nurse manager institute, but it was something that they wanted. They wanted a leader development institute. And so we walked in, really delivered the learning needs assessment and created a 4-part series that is delivered in person to their leaders, nurse manager, and director level team members. It has been incredibly successful in terms of how they have viewed not only from a learning needs assessment standpoint, but also their confidence in terms of how they are leading their teams in the front line. And what has been reported back has been really anecdotal, but what we're working towards is something that is really truly concrete. So we're working with the University of Buffalo to really partner with this large healthcare system in how we're going to study it from a nursing research perspective, as well as publish it, so that we can really share that within the body of knowledge, and how that Nurse Manager Institute and Nurse Leader Academy, I'm using those terms really interchangeably, impacts the greater good of that organization from a patient satisfaction standpoint, as well as a safety and quality standpoint for their patients.
And one of the really great stories that we talked about in that business review was some of the training that, quite frankly, we identified in partnership with this health system, specific to code and what we're doing for our talent on assignment. Would you spend a couple of minutes and talk a little bit about that? It's a really fantastic representation of why we do need to keep investing in our talent so they can be better.
Absolutely. There is certainly in the med surge and telemetry space just the need for clinicians to know what they need to do from a first responder standpoint. And we saw with our partner just an opportunity to enhance and improve what they were experiencing through a rapid response standpoint, and how clinicians were responding when a patient was exhibiting an emergency in the med surg environment. And so we partnered with them and really truly led in with our modules of just refreshing our clinicians' knowledge and education around what do you do when you're the first one in the room and the patient has coded? What do you do when the patient maybe is exhibiting signs that they're beginning to have some acute changes in their condition? And what we learned from that is that not only has it improved their rapid response outcomes, it's also a best practice that they want to partner and use some of the tools and resources that we have to do some mock codes to refresh the knowledge of their clinicians as well. And so we're going to be hand in hand with this organization along with our on-site supervisor. We actually have at this particular client a nurse that is in person and on site to support this work.
And that was the fun part about that learning and the
Mhm.
discussion is it really didn't have as much to do with the business relationship that we have. It really had more to do with the outcomes
Mm.
for their patience and, frankly, the development of our talent. One of the things that you and I've also spent a lot of time thinking about is finding ways to engage with our talent, recognize our talent, thank our talent real time. And during Nurses Month, you did something really creative to get after some of what we're talking about here, which is the recognition, the development, the ongoing engagement. You found a really great technology platform that we use during Nurses Month. I believe folks would enjoy hearing about that case study a little bit. Maybe you could foundationally set the landscape for people so they understand what we were doing, and then I'll pepper you with a bunch of questions as it relates to outcomes. How's that?
Absolutely. We know in the healthcare space that there is certainly an opportunity to make sure that there's meaningful recognition and that it is tied to something substantial. And a lot of times the budget and what is substantial translates into a pizza party, which with the very best intentions just is not always well received on the clinician side. And
You and
so
I are going to end pizza parties, aren't we? I think that's our charter, Natalie.
I
We're going
know.
to make pizza parties go away.
Absolutely. And although well intended, you just can't reach everyone. And there's a constant discussion with clinicians about, well, I don't really eat pizza. So how are you really truly going to thank me? And so we really engaged in a more meaningful partnership that could tie to recognition in a much different way with a meager budget as well. And what we decided to do was to really engage with this technology partner using a real time platform where we could send out a digital card that was Prolink branded and it went into the clinician's wallet. And so they each received a monetary amount, which was somewhat, modest, but we could track and see all of the different interests from all the different age groups and walks of life and specialties in terms of what people really truly received as recognition. And then we measured that against what truly were the outcomes that we were trying to achieve there around retention, around lowering our early terminations, and also did the message meet the clinician in the way that we wanted it to? Did it feel like they were being recognized? And many of them, most of them, if not all, 90% of them said that it absolutely did tie to meaningful recognition for, in this particular cohort, Nurses Month.
We sent this out to north of 3,000 talent, correct?
Absolutely, we did.
And one of the things that came back that you and I and the team that did this were most struck by was, I'm a Starbucks guy, as you well know. And if somebody sends me a Starbucks gift card, it's gone tomorrow. But there's a lot of folks who may not necessarily want a Starbucks gift card or an Amazon gift card. Maybe you could help people understand. Remember the wheel that we got back, which
Yeah.
showed where everybody was spending the money? Could you share a little context around that, because it was really compelling?
Absolutely. And to your point, David, we know that people get the Starbucks gift card, and I just did a little rounding session asking people, do you know where your $5 Starbucks gift card that you got for Employee Day is? And many people have no idea, and the money is gone. They didn't tie it to the recognition, and we're out of $5 per employee. This was so different. These individuals got it. We were able to track it. They captured it. They claimed it. They spent it. And when you think about how, if we have these wellness dollars, which is really how we framed it, what is wellness to me might be able to be to take my kids out for a hamburger. What is wellness to someone else is to be able to purchase a book or to be able to buy a yoga mat or and so we really got a lot of that intel back, with those being the top areas that they were really spending it around: food and in books.
There was a lot of feedback. Some of the verbatims were much more intentional about feeling appreciated and recognized. Forget, the fact that there was a monetary component tied to it, the sentiment wrapped around it and the sentiment tied to ProLink. And is there anything that you recall from some of that commentary that you'd like to highlight here as it related to what our talent were saying about this style and this approach of either recognition or affirmation?
I think it was really them appreciating the fact, and there was a comment back, and we used it to your point, internally with our internal clinicians as well as externally, and it was consistent. I get to use a branded card. I walk into a retail or into a restaurant, and it's a ProLink card, and I get to choose how I spend it and when I spend it, and I know that it's there. And every time I look at that, I remember, wow, I was really recognized. And so those clinicians really felt that they were appreciated, and they were able to tie it back to the fact that, yes, these were dollars that were gifted to me, but it was very purposeful. This was for Nurses Month to recognize me. This was from my employer. And it was very much appreciated as well.
And that's the part that I like as I think about the conversations you and I have with our largest health systems, and as they find ways to attach the effort, because we know there's a lot of work that our clients put into engaging and wanting to recognize our talent. This is just another tool that makes it a little more personal, and that's personal touch is a lot of what you and your team are driving as we think about the relationships you have with our clients. And frankly, this pivot for us, which I love, where we think about every day, the work that we do is all about, putting care in motion. It's more how we think about our role in healthcare and supporting our clients. Could you talk a little bit about that pivot in messaging for us, frankly, that extends not only to our clients but to our talent?
Well, we know that healthcare is so much about action, and having care in motion means that we're taking action. And that action is constant. We are constantly out seeking with our clients, how can we be better? How do we ensure that we have the very best talent in front of them? How do we make sure that we're providing a world-class experience to our clinicians as well? And one of the ways that we've put care in motion is staying very intentional in terms of the voice of the clinician. We have a strong clinical facing organization, clinical forward organization that really stays committed to evidence based practice, which we know is so important to the facilities and the clients that we serve. We also make sure that we've got the voice of our talent. We have a talent leadership council where we are focused on what is happening out in the community that they're working in. How do we best support them, not just through compensation, but through programs? What do you need? What is going to keep you engaged? What is going to keep you retained? And not only retaining them with ProLink, but also retaining them within the profession of nursing or in healthcare is just so very important. And so that action driven word motion is just critical to what we do.
And I've been a couple places along my healthcare staffing journey. In this particular instance, the way we look at NPS specifically with our talent, it's worth highlighting here. Maybe you could spend a couple minutes letting the audience understand how you think about NPS, how do we use it. That voice of the clinician matters a lot. So, any color you want to add around NPS?
Absolutely. Coming into ProLink 2 years ago, one of the first places I started in the data was to really look at our Net Promoter Score. It is equivalent to clients that we work with around employee engagement or even patient satisfaction. So how satisfied are our clinicians with the assignments they're on? What are they hearing? What are they feeling? What are they seeing? Where can we reproduce what's working well? And that is really where we've spent that time. We stay to the north of what is considered really world class, between 60 and 70% at any given time at ProLink. And that's been really through intentional action planning and sharing, not only with internally, where we are with Net Promoter Score, but that feedback loop with our clients on how do we get better? Where are we really winning in this space? And how do we help them to improve from a workforce standpoint as well?
The piece about NPS that I'm really enjoying here, especially as you drive it, it's not only the perspective of the client, it's the talent, but then it's also the perspective that the talent gives of their experience with us. their recruiter, our credentialing organization, and as you and I meet with our clients, they're just as fascinated and interested in what's the talent's perception of them as the hospital or health system that they're supporting, but they want to know what that talent's experience is like with us. And that's the piece that I've come to really appreciate about why the NPS piece is so important. It's so important to how we think about putting care in motion. If you were going to wrap up and give folks some final thoughts around why you and I are so passionate about having clinical be and our talent be sort of the first focus of this conversation that we want to have, how would you sort of summarize your perspective or what you're attempting to do to really help both our talent and our clients be successful in what is really a tough talent environment?
I think it's several things. It's for number one, it is definitely to focus and put our talent first and the patients that we serve first, the people first. It is very much a competitive environment, and so making sure that we certainly understand what those what those opportunities are to improve. But also, I think that sometimes we focus on things that are not working well. There's a lot of spaces that we're winning in healthcare. There's a lot of innovation that's taking place today, whether that's workforce innovation, whether that's technology innovation. And so, one of the things that we really think about at Prolink is how do we stay ahead of that from a technology standpoint, from a process standpoint, because that's how we win. We know that we can certainly take the voice of customer, whether that's the talent, the client, or internally, but how do we put that in motion and how do we think about things differently and be innovative in the space?
Well, Natalie, one, it's been a terrific opportunity for me to work and partner with you and learn a whole lot. And I'm excited about this series. I hope those that find us and find this conversation find value. And if there's anything that you, those that are finding us new here, want us to talk about, Natalie and I can talk about many topics all day long, but we really want it to be driven by those of you that find us, that lean into this conversation, whether it's on the client side or whether it's on our nurses side. So, Natalie, this was fun, and I can't wait to do this again soon.
Absolutely. Thank you.